Gentlemen, if you're dealing with a problem where your penis feels firmer than normal at rest, you might not just be imagining it. Maybe you've noticed some unexplained pelvic discomfort and some sensation changes at the shaft or the base of your penis, and now you're understandably living in a world of anxiety. You're not alone. This rare condition is called Hard Flaccid Syndrome, and there is a way to fix this. I'm Janishi Swope, a men's pelvic floor physiotherapist, and I'm going to review everything we need to know about how to fix Hard Flaccid Syndrome in an evidence-based way. Today, we're going to go over a 3-step actionable plan that involves stretches, exercises, and relaxation techniques so you can get back to feeling normal again. So Hard Flaccid Syndrome is a condition that typically occurs in younger men ages from 20 to 30, with an abrupt onset after sexual or penile trauma. And you'll see some common themes: a semi-firm flaccid penis, especially in standing, changes to the penile base or shaft that can be numb or sensitive, reduced erectile quality and a reduction in morning erections, and of course you've got your pelvic floor tightness, which is that unexplained tension down there, and of course all the anxiety, hypervigilance, and fear about sexual function. Now, to be fully transparent, the evidence that we have right now comes mostly from case reports, expert opinion, and the research we currently have on chronic pelvic pain and erectile dysfunction. So we don't have big clinical trials, but what we do have are patterns, and patterns point to a clear direction. Keep in mind that Hard Flaccid Syndrome completely differs from what's called Peyronie's disease, which is a condition of the penis where scar tissue is formed in the tunica albuginea of the penis. This causes that penile curvature, and if this sounds like you, go ahead and check out the video I made in my channel earlier about Peyronie's disease. So the leading hypothesis for Hard Flaccid Syndrome is believed to be caused by neurovascular impairment. Specifically, neurovascular entrapment indicates that there is a nearby nerve or a blood vessel that's being squashed or rubbed into a tight space in the pelvis. In the pelvic floor, this often involves the pudendal nerve and its nearby artery and vein, as they travel through narrow tunnels of ligaments and muscles around what's called the ischial spine of the pelvis, and a small passage known as the Alcock's Canal. In Hard Flaccid Syndrome, the pelvic floor muscles reflexively guard, and stress and anxiety keep your fight or flight responses high, so the muscles and the small vessels never fully relax. And as a result, there's a persistent tone in the pelvic floor muscles along with the smooth muscles in the penis. Of course, you should always first follow up with your doctor, especially if you have something like a sudden fever, severe testicular pain, or blood in your urine. These are not normal symptoms associated with Hard Flaccid Syndrome. So how do we treat Hard Flaccid Syndrome in the first place? The evidence suggests that we need a multimodal plan: pelvic floor physiotherapy, pain science education, maybe some sexual counseling, and probably some psychological support. Several case reports between 2022 and 2024 show that men with Hard Flaccid Syndrome improve almost fully when pelvic floor physiotherapy is implemented. This is treatment involving physiotherapy exercises and stretches specifically targeting that neurovascular impairment. A 2024 case report showed lasting improvement when implementing a multimodal plan, and this involved a low-dose PDE5 inhibitor, in this case they used Cialis, pelvic floor physio, and something known as low-intensive shockwave therapy, and these benefits were maintained at the 2-year follow-up. In the best documented case, in 2023, there was a single case study of a 30-year-old man who showed 85% an improvement in his symptoms, meaning improved erectile function and psychological status over a 3-month period. In the study, he was very vigilant with his pelvic floor exercises, his stretching, his relaxation, and the pain science education that he received. So in the clinic, the men that I see with Hard Flaccid Syndrome typically have an increased tone in their pelvic floor muscles, specifically the ischiocavernosus, bulbocavernosus, obturator internus, and some of the surrounding hip and abdominal muscles. This constant tension leads to this negative feedback loop of reduced blood flow, leading to altered sensation, leading to anxiety, which further creates more tension. My job as a physiotherapist is to help break that negative feedback loop by using treatment techniques such as manuotherapy, dry needling, and of course the exercise prescription. By the way, if you have Hard Flaccid Syndrome or know somebody who's had the condition, drop me a comment and let me know, because I'd love to hear your story. So knowing all this, you might be asking, what can I do at home to help improve these symptoms? The first step is to focus on down-regulating our nervous system. Box breathing is a quick 5-minute breathing routine where you focus on slow inhales and exhales for the purposes of down-regulating your nervous system. With practice, this will help your stress and anxiety, but you have to stay committed to it and you have to set aside that time. And so with box breathing, you want to inhale for 4 seconds, hold for 4 seconds, then exhale for 4 seconds, and then hold for 4 seconds prior to taking your next breath. By the end of the 5 minutes, you should feel like you're more relaxed. Step 2 is to perform a gentle release with awareness of the pelvic floor muscles. One exercise I get my chronic pelvic pain clients to do is to take 2 inflatable soft balls and place them directly on the perineum, that spot between the anus and the testicles. As you sit on the balls, I want you to take a deep, controlled breath, and as you do that, you want to feel the pelvic floor muscles gently descend onto the balls. If this is comfortable, I'd get you to move a little bit left, a little bit right, up and down, feeling for any spots of tension, and I'd want you to do this for 5 minutes a day. Step 3 is to perform simple stretches for your pelvic floor. One stretch that I like to get my clients to do is called a happy baby's pose, where you lie on your back and using your hands gently separating your knees, stretching your pelvis. You want to feel a good stretch in your groin and your pelvic floor, and you want to visualize that separation through the sit bones as you're pulling your legs apart. This, along with some other stretches for the pelvic floor, is something that I get my clients to do for 5 minutes a day. For a bonus step, I would encourage everybody with Hard Flaccid Syndrome to just go ahead and do a general stretching routine for your lower body and try to identify where you're feeling tense. Identify which regions are fairly tight, and then create your own home stretching routine specific to this. Try to stretch hip flexors, glutes, groin, and of course your pelvic floor. It'll definitely be worthwhile to continue stretching those regions as they may be indirectly contributing to that nerve entrapment. And remember, Hard Flaccid Syndrome is a blood flow problem. We want to find ways to reduce tension and increase the blood flow in the region, so I'd always encourage people to stay active, go for walks, try not to strain when you're sitting on the toilet, and certainly to try to avoid ruminating and contributing to those negative feedback loops in your mind. So Hard Flaccid Syndrome is real, it's treatable, it's not just in your head, and most men improve when we approach it with the right plan. If you want to learn more about a pelvic floor stretching routine that will help with your condition, go ahead and click on this video that I made. It's a 5-minute follow-along pelvic floor stretching routine that you can use every day. Step by step, I break down exactly what you should be feeling during this routine. If this video helped you, please go ahead and hit that like and subscribe button so we can keep showing this to more men who might need to see it. Thanks for watching.